This is our January session of screening and supporting. We have one county, Santa Cruz, who's not able to join us today, so they requested to record. We have not all gathered in this cluster, in this gathering since October of 2025. And so it's really good to be back together. We've got a lot that we want to offer and share and connect this morning. Our primary purpose is not only to psychoanalyze your checks, mix, elimination vote of 2026, but our hope for this time together is for us to kind of pause all the other things that have been happening in our email boxes and our Teams and our Slacks and focus in on the universal screening planning. And also we'll have time, the main piece today is that we'll have time to really unpack the template that you all received in November from CBH. And so we'll go over it. We'll have time to go over it together and roll up our sleeves and see where we are, where we need to go, and how we can support ourselves and each other to get there. So I invite you to do a little bit of stretch, a little bit of deep breath. Welcome, Siskiyou's in the house. And I'm just going to move us ahead. Here we are. Okay. So like I said, today we'll have a moment to revisit our last session in October, which is where we got to hear from Dr. Moore on teaming and its the foundational aspect of teaming with universal screening. I don't know about any of you. I cannot remember what happened last week, so I definitely can't remember what happened in October. So Tina will be walking us through a little bit of a rewind. Then, like I just mentioned, we'll have time to deep dive into the CBH preliminary plan template. And then Christina is going to walk us through some action planning for how to get from where we are now to the template submission. Some of us have a May date, some of us have later dates. That all depends on what you have communicated with CBH. But no matter what, we're all committed to using the template as a roadmap for this work. And I'm going to just name that we're all in different places, like we've said before. So I'm trying my best not to say year one or year two, because we're all in different phases. So we are exactly where we are now, and we'll get there together. The reminder is that we're going to aim to close the main session at 11:30, and then that 30 minutes is open for folks to stay on, either to chat with me, Christina, Tina, with each other, to share resources, to ask questions, or to get some workshop time. So you're welcome to exit if you've got other things to do. You're welcome to stay if you'd like some held time to go through all the things together. Okay. A couple more pieces before we get into where we were last session. So I'm going to invite Tina or Stephen to drop the link to our BHSSA Universal Screening Hub. And that link will bring you to the Universal Screening channel in our hub. And on the channel, there's a link that says January session, and that has the deck for today. It has the action plan link. It has the CBH preliminary plan template, and it also has the planning guide. So all the resources that we'll be discussing today. Tina, if you can drop that link in chat, that would be helpful. Thank you. And if you're also someone who wants a PDF of today's deck, you don't want to go through the channel right now, you just want the PDF, let us know in chat and we're happy to drop that as well. Okay. So a little bit of a forecast of where we are as a learning collaborative going and looking at this year. So today is already January 13th, and we'll be mapping out and really unpacking the template. You'll see in blue, and you should have received in your email yesterday. And if you didn't, please let us know in chat. Okay, seeing some requests for the PDF, so Tina's on it. The font in blue are office hours that Christina from the Plaster team will be holding for any drop-ins to get support for any part of either your action planning or filling out the template or project mapping. These are completely optional. So we sent them to your calendar with the Zoom link to join. So it's not even a register, and you should all have them in calendar invites. I full disclosure, I put the question mark in my acceptance so that I had them in my calendar, but they didn't potentially bulk up. So just want you to know that those are all up on the calendar, and they should be on our event calendar, also on the hub as well. We'll be meeting again on February 20th and on the 14th for this main session. That is our learning collaborative dates. And then the preliminary screening plan is due to CBH on the end of May, unless you have heard otherwise from CBH. Some of you have different dates. And then we'll have an optional session in June. And then 2 main sessions in the fall. So we'll have a little bit of a summer break for this collaborative. And if you want to have over the summer hangout and coaching spaces for your work, we're happy to gather us optionally as well. So I want to just pause to see if there are any questions, technicals about links, calendar invites, Zoom links, any of the things that I just walked through for this gathering. So thinking about where you are in your universal screening grant process, sharing either out loud or in the chat, one W that is feeling pressing and clear for you in this moment. It can be a win. It could be a wish. It could be a worry. It could be a wash. We tried to do this team. We tried to do this team formation or team design, and it went awry. Or we tried to meet with our community to introduce what universal screening could be, and it went left. Or one why that I do this work. So we're going to take a couple of quiet minutes and do some chat waterfall. You can pick one W or 2. This is a moment for us to have a calibration moment with ourselves and each other, and also welcome you to unmute and share out loud if you're open to it. Okay. Hey, Heather. I hope that's a win. I think that's a win.
I'm sorry, I meant to put a win before that. Yes, it's a win.
We complete our needs assessment. Can you share a couple more sentences about that win?
Yeah, so we have been meeting with our planning team and also meeting with our evaluation team. And collectively, we came up with a pretty comprehensive, layered needs assessment for our LEAs to complete, and got feedback from the planning team and finalized it. And they are now, for the month of January, going to get their relative team members at each LEA together and complete the needs assessment. And then from that, some kind of organically, what came out of that is we had almost like a readiness checklist embedded in that needs assessment. And what we decided to do was to create a separate readiness checklist that has the resources embedded into the readiness checklist with all the different phases to ensure kind of they're ready to screen when the time comes. And so they were also provided with that readiness checklist to kind of use in concert with the needs assessment. Make sense?
Sounds really easy, and that you just, snap did it in one. And in that win, along the process, were there any wishes that you and Mana and Rachel, like, you wish you would have done differently, or learnings along the way for other folks who are not yet where you are?
I don't know. Mana, Rachel, weigh in, but I feel like the process needed to happen the way it did to help us come with our end result of creating these 2 documents, the needs assessment and the readiness checklist. And so I don't think so, but I don't know if Mana or Rachel have other thoughts.
No, I think I agree. I think it's just really important that we're setting the tone and letting them know how we're going slow and it's all good, and, give us your feedback. And so that's really helping them feel like this is manageable. So I think it's just important how we're setting the tone for them. And so nobody's feeling like it's overwhelming and it's one more thing.
Right.
So I think that has just been really helpful.
What we also,
Yeah, that's really important. Like asking them, is this doable? Is this, really getting their perspective? Because we know they have, competing priorities and so much going on. That's a good one, Mona.
Yeah, what we're also hearing, or what I'm sensing, is that your team is leading with a lot of withing versus adding. Mm-hmm. With our planning team, we're doing this with our LEAs so that it feels partnered. Okay, I'm seeing a win from Pilar and another win from Leslie and others. I'm just curious if anyone else would like to unmute and share a little bit more text behind your text. This is a good check-in. Thank you, San Diego.
I could share. So we're formally, everything was leading up to right around the holidays. And like you mentioned earlier, Leora, I could barely remember what I did yesterday. So the idea of starting to get going and get people like up and running in November, December just wasn't an option because we'd forget by January. So launching today with an elementary school district, and it's just a small and mighty team. Natalie's here, so she's going to be joining us from Santa Clara County Behavioral Health, along with my team. And then we're going to be working with one district director to really just find out who is it that we need to have at the table. We have a wellness center at this particular school that we're going to be working at that my department operates. And so we're trying to do the with as well, not have it be an extra. When I invited this district and the other district that ended up backing out, but when I invited this particular district, I said, we're going to do one meeting a week or one meeting a month. We're going to try to like tie it into some of the other things that we're doing so that it just doesn't feel like another extra, another something. And so got our agenda going. And so we'll see how that meeting goes today. And then I'll be introducing this to see if a high school district will pilot it with us. And I don't know, I'm going to try to smile and get them with some charm and say like, it won't be a big lift. Because I think that's the biggest thing. I'm like, if you won't have to do it, no one in your staff will have to do anything extra. We will provide support, in whichever way we need to from, whatever that's going to look like. If we have to get some subs to help, we'll get some subs to help and do what we need to do. So yeah, this year is just really about the planning for us where, it's about the planning part of it. And then we won't, go to launch the screener until next school year in the fall, but this will be the whole planning and really just hearing what are some of the concerns and what are some of the things, which I think also helps inform what we're doing in our wellness centers anyway. So it's a multi-pronged approach of what we're going to be also able to receive to help better design and support them in the wellness spaces next year.
Yeah. I'm curious, Pilar. So Pilar is sharing that you've got partners both at an elementary school and also at a high school. I'm curious if we can just get a hand check, a raise of hand of who is, or even in chat, of who's partnering with elementary, middle, and high school, because in some ways there's universal approaches to all three types of schools. And in some ways the screening approach can be extremely different, especially if you're working with an elementary school or high school. So I'm curious in chat or even just out loud if we can signal like we're doing both. Oh, cool. Rosina, middle. Leslie, you're doing both. You're doing all three. Mm-hmm. Is there anyone else who's doing?
We're doing three as well.
You're doing three as well.
It's an elementary, but there's a sixth grade. So it'll be like a third, sixth. And then I'm trying to get the ninth.
Mm-hmm. Mm-hmm. I'm curious and happy to signal in chat or afterwards if along the line or in one of the office hours, Christina, that we can also talk about developmentally appropriate outreaches or engagement or tools to different stages of screening so that we can all be aligned in practice with how we're approaching school partners. Okay, I'm seeing some nods. Welcome, Christine. Anyone else want to share about a wish, a wash, a win, or a worry that you shared in the chat or you haven't shared but want to out loud?
Share a win that we have had. I got the team together and we've got 15 people on that team. And because we're a pretty small district, I asked a representative from each of the schools districts to come, so that this could be kind of a collaborative process for everybody and everyone could sort of make their own determination, although the team was leading towards having one universal screener for the entire county in our district. So it was very good. I was super apprehensive because it feels like a big ask to have everybody come, but almost everyone came. And we had the two presenters, one from Impacted Pathway and one from Toolkit Health. Mm-hmm. Super good. These are, what we really love Impactor Pathway because of the strengths-based orientation that it has. Instead of looking for what's wrong, they're looking for what's right. And then, but not missing the stuff that's wrong, but the focus is on what's right and what could be better. And then, so in the meeting, we had those two demonstrations. We talked about it afterwards. And then I have sent out links to all of the other psychometrically sound universal screeners that I was able to find so that everybody could review that information. And then I said, do you all want to meet in a couple of months or what do you want to do? And they're like, no, we should meet next month. So everybody's like super psyched to get going. And I'm very excited about it. And yeah, it just feels like it was a huge win. And I'm super excited about these two presenters that we've had also because it's a completely different way of, at least to me, being not super familiar with everything that's out there, to have these two very interactive kinds of ways of working with the kids, I thought was amazing. And I think especially high school and the middle schoolers would really appreciate that interactive piece.
Yeah, and we imagine, Leslie, that you setting the tone for being a choosing strength-based partners also is there is a definite connection with why your partners are all in, right? So that there's a feeling of shared value, shared why, shared approach to the conversation.
Great.
Yeah, big shift for El Dorado from our last time together in October. Big shift.
I know. Well, and because I feel like I'm finally getting my hands on some stuff, and the conference in Orlando was unbelievable, and I highly recommend it to anyone. And got so much really good information, and spoke to some really, PhDs who had done all this research. It was fantastic. But so.
She's referencing the National Center for School Mental Health's annual School Mental Health Conference in Orlando, which I think this year will not be in Orlando, hopefully, so that we can, on the West Coast, be closer.
It's going to be in Nashville.
That's right. It is going to be in Nashville. Okay. 4-hour flight versus 6-hour flight. So we'll all see each other there in December. Okay, I'm noting our time. I want to hand it to Tina, but I think Pilar and other, like even Leslie, if you've got ways that you can share your learnings and partners that you met at the conference, all of that peer resource and exchange is really helpful for other folks. And I want to note that if you are feeling like, I don't have these big wins that we just heard from Santa Clara, from El Dorado, from San Diego, if you're feeling like I have more worry or wash than I do win, all good. That's exactly right, because there's no way that we are just one. We are doing it all, and it's complicated work. So if you feel open to sharing that you're in a little bit of a shaky moment, that can help us also support you and think about how to bridge your worry to a win. I'm going to move us. Thank you for sharing, everyone. I'm going to move us to Tina, who's going to do a little bit of like a what happened in October moment. And I welcome you who were with us in October with Dr. Moore's presentation and work with us on teaming. If there are pieces that you remember and that really made a shift for you, or even were examples of bite-sized or right-sized ways of talking about the work that you can copy, paste, and repeat to your partners, please share that in chat so that we can skill each other up. So Tina, I'm going to hand it to you.
Sure. Thank you for that. And thank you all for sharing your washes, your wins, even your worries. Where I'm going to go is to a review of last session and just a few minutes here. But what I will share is that on the hub, we do have these slides. So by no means will I do it justice in just a handful of slides, but just to catch us up, we were lucky enough to have Dr. Moore share and guide us through teaming. That was the focus of our last session. What I really appreciated was her guidance through questions, right? To really discuss our flow. And what I love hearing in the examples given earlier is that this really is guiding the work. It's focusing in on the who and the how. Who is on your universal screening design team? And we'll talk a little bit later, and you'll have some time to actually engage in Christina's action plan that dives into these questions, moves us from design team or distinguish between design team and implementation team. So we'll talk all about that. But from there, once you know that who, she also guided us with how does this team represent the local community? We talk about centering a youth, staff, family, community member voice. So how do you do that? What expertise is needed, missing, and that we need to include in these meetings? What are the clear roles and responsibilities of team members? I'm going to show you a slide where she actually gives you some examples and breaks it down a little bit further from general to the more specific. And then finally, who on the team will monitor? Will monitor all of this. So once we pilot, once we come up with all of these ideas, will it work? Does it work when it's in play? And also, what do we have to do to pivot? So these were the questions that guided our work. When Dr. Moore talked about team composition. Again, think about the examples that, for example, Leslie, you just shared, that there's multi-layers here and complexities exist, right? That in California alone, folks working on youth well-being may include folks from the spheres of health and human services, education, of course, but education is so layered, justice or juvenile justice, maybe child welfare. And so there's so many different circles missing in the diagram here. But also looking at the different levels at the schools, within our education sphere, school, district, county. You just heard examples of, and many of you are in this from elementary, middle to high school. So within these circles, they are multi-layered too. And do we have representation, or are they a part of our teams? So looking within that internal team as well as outside of it, external or across teams is really something that she focused in on. When we talked about what are the roles, you'll see this come up quite a bit. So I won't spend too much time on it, but everything starts with the why. From action planning, we always want to know our whys, our reasons for our needs, goals, and it may be different for all, but coming together and discussing it and coming up with some overriding ones are going to be important for us to move forward and to come up with that plan. Of course, including and creating buy-in from others, critical. Doing that asset and resource mapping is going to be important when we're systems building and refining. Other responsibilities can be, of course, responding to what's coming up in the data. What is the data saying and what do we do with it? How do we engage and get the community and families excited about being a part of this process and actually being free with and sharing that information? And then the ongoing developing, maintaining, sustaining partnerships, right? That helps us not only in universal screening, but across our comprehensive mental health systems and of course, evaluation as well. Won't go into too much detail, but just notice the nuances, the differences between what can be specific roles and responsibilities between county, district, and school teams. A lot of times it's who they are liaising between, and many times it's a difference between truly design and more towards the school team looking towards more of the implementation piece, right? And giving that information back so there's this fluid communication between all and less overlap, more coordination. So specific roles and responsibilities. And finally, when we're thinking about team members and bringing folks on, really thinking about what competencies they can bring. And they really do fall under 4 categories. And I'm sure we can expand on them, but we need folks at the table who can develop and again, sustain those relationships, give guidance and help move this mission forward. Building effective teams is going to be important. We spent a whole lot of time with a focus on, again, building that initial team and then shifting to implementation team development. And then analysis and diagnosis. Does it work? What do we have to do differently? What's happening here? Is it a systems issue? Is it something else? What is, again, the data telling us? And finally, now making decisions and actions moving forward to facilitate change. And so taking all that we know and actually putting it out there so that we do have a universal screening plan that works. So that was a quick and fast wrap up of Dr. Moore. Again, visit our hub. That same channel link in the chat will get us there. But I want to stop and pause because I tried to speed through that and I thought that can be quick. But we heard from others, but who hasn't shared or who would like to share about what your teaming approach looks and feels like? If you are in that process of assembling team, what does or who makes up your design team? And if I've missed anything, those nuggets, those things that stuck with you from the last session, share with us what resonated with you. So I'd love to see who would like to share a little bit more about teaming and the Dr. Moore session. Maybe it's also a win. If you even have your design team, maybe you had your first meeting. What does your scheduling look like? Any interesting partners? I know Leora in the chat is asking a little bit about justice systems, if you're involved with them. So who's a part of your design team? Who's giving feedback or guidance?
For San Diego, because we have our other MHSA grant, the COPES grant. So this is like a subset of that. So we have 31 LEAs we've been working with over the past 3.5 years. And then from there, we decided based on data, readiness level, interest, capacity, which LEAs we wanted to invite to the planning committee that represented everything ranging from K-12, small, large districts, not large, medium, charters and school districts, just to have a diverse representation. And then we invited some of the key school partners that are pretty much in a lot of our schools in our county. So we have like Wellness Together and help me. Oh, Rady's Children's Hospital and our County Behavioral Health team, department, unit, organization, County Behavioral Health, and and then our evaluators at UCSF. So I think is that everybody? So really just getting those school partners that provide direct services in schools that possibly do screen or have screened in the past, and along with our LEAs and our evaluators and of course our team here at STCOE.
Love that. Thank you so much, Heather. And I'm hearing so many things in the process that are sticking out to me from the 31 LEAs, right? Making that shift too, to see who's really the champions, who want to help move this process forward. And so I'm hearing, the initial invitation and then a shift to design team, and then even a shift even further to implementation. And then the inclusion of all of these different partners from Rady's, from County Behavioral Health, your evaluator as well, and of course the internal team. So couldn't ask for a more amazing example to see all these different pieces are being touched. So I really do appreciate that. Yeah.
Yeah. And also one of the LAs is currently doing universal mental health universal screening. So kind of learn from them what worked, what hasn't. And also through our COPES grant, we've done resource mapping. It's already kind of embedded in the work we're doing. So they all have that in common as well.
Sure. Mini pilot. And then you have all of the, again, assets and resource mapping happening at the same time. So, and also that it doesn't have to be all led from here. that you have all of these different team members who are taking it in different directions, moving it forward. Thanks, Heather. How about others? A lot of times there's a focus on numbers, and I just want to elevate both San Diego and, Leslie, you shared earlier about having 15 and not sure who would come, and look at the folks that did come to support and the interest that's there, even when we didn't think existed. So wonderful to hear that shift too. And that they do represent what I'm hearing in both examples is the representation of the LEAs, the sites, the schools. So they all want that voice too. So invitations work. Anything else from our group here? Anybody else want to share about their teaming approach? Or
I'll share, Leora. Sorry, Leora put it in the chat asking me.
No, I love it. Thanks, Anna.
But, so we focused in on inviting everybody a few months back that was in some form a school-based mental health role. So either behavior interventalists, wellness coaches, clinical counselors, those type of people. So we offered the invitation to every school and district we have here, and then based on their interest, we pulled together a team. And so out of 13, we have 9 schools, and we're representing 6 different districts. So they're our core group planning team because they're identified as who the work is probably going to fall most on their shoulders. Sure. And from that team, we've developed a plan for how we're going to be getting the voices of our community partners and our county mental health and all of that to give feedback and be a part of the planning process, because we're not going to make it without them. So while those people are not on our ongoing team, we are going to pull platform together for them to be able to be a part of our planning and making it all possible. So each school has been tasked with developing what is going to work best for their community, their kids, their age groups, and it is from K through 12 that is represented on our team as well. So it's rolling. It's had some bumps in the road, even though we're working with that specific population of school-based mental health people. I wasn't expecting it at my first convening. There was a challenger at the table who was really like, why would I be pushing this agenda? And, it gave us some really rich conversation, and where I think it's going one way, we kind of had to be fluid and adjust to maybe we need to focus more on this part of education and awareness and that kind of thing. So it's been fun. I'm enjoying it.
And you're still smiling and you're still moving forward. And what I'll say is, thank you for bringing up the issue of challengers. And what I'm hearing you say is that it really did not only get folks engaged, but it helped you to kind of strategically address whatever the issue is. Did you want to share for folks what that issue might have been?
It's just more about getting. So he's a clinical counselor, but he has his role and he has his day-to-day stuff that he does where he's comfortable and familiar, and he's at the high school, so the high school is also comfortable and familiar with what he does. And so he was kind of struggling with like, how come I'm going to move forward with this work? And so we had to kind of really go back to the why, and was beautiful because out of that meeting, we really came up with a collaborative just like undertone of why we're doing this. And for our county, we're in rural Northern California, who very much does not like the government telling us what to do, and knowing that is the greater voice of our population, that what we're doing is allowing ourselves to have this planning opportunity to build and have a voice for what might work specifically for us, even if it never comes down as a mandate. Or if it comes down as a mandate, that we are prepared with our own voice and our own plans and what works, not only for our greater county, but for each school as well. So it's going to be different so it's a lot of moving parts, and it's been bumpy, but we have I have an administrator right now who's really kind of pushing back against the work because he feels like we're never going to have the capacity to implement it. And so that challenge too of, how do I navigate this conversation and really making sure us as a team, we understand what our why is really, why it is a why, and what it can serve, even if it's not at implementation, what it can serve as far as if we don't go and get the data and the information, how do we ever have any backing for a need and stuff like that? So
thank you, Anna. And let me just say that you invited in the challenging people or the challenge or the issue early so that you could address it as a group. And what I'm hearing that came out of it is that collaborative why, and also preparing for how do we present this moving forward, knowing that there might be others who have yet to vocalize their challenge or their issue. So I think what you shared is valuable because I venture to say here, other folks may or have challengers, right? So thank you for sharing kind of how you got through that and how you're moving forward and it's not stopping you. So thank you all for those who shared, continue to share in the chat. I'm going to stop us here, move us back and hand over to Leora so we can catch up on some of the other important material too, but continue sharing. Appreciate all your stories.
Thanks, y'all. Okay. Here we go. Well, gang, you ready? We're gonna introduce all the things. So before I hand it to Yang, I want to offer that when we are talking about our resources in our community practice today, we are talking about 3 resources. We are talking about the process guide that we created and shared with you in October, and that is those are really hopefully thoughtful, generative questions to help you and your design team, your planning team steer the work. They're also questions that you can copy and paste and use in your own quarterly meetings and with your design team. The second is the preliminary plan template, and that was sent in November. And I'm going to drop that in the chat right now because that's what we'll be digging into in this portion. And then the third is an action plan, which we're introducing when we come back from breakouts. So right now we're double clicking on the second link. And I'm going to hand it to Bing to do a little bit of an intro of the preliminary screening plan template. And then we'll have time to move into our SSPs, our breakouts, to do some tech study of the template and familiarize ourselves with it a little bit more. Okay.
Shall I start?
Yes. Oh, yes. Thank you. Yes, I was looking at you, but you can't tell in the Zooms.
Thank you so much, everyone. I'm really excited to hear all of your stories about the current implementation status. And I'm hoping that this reporting tool, well, this template here is serving as a supporting tool instead of an evaluation. And we're not looking for a perfect plan in any way. So I'll just give you a little bit of a background for how we approached the preliminary plan template. The plan template was developed based on the language outlined in our original RFA. And we tried to match with also the general deliverable structure in the contract. So we've incorporated the planning guide created by our partners and the CARS team too. So the general goal is for our grantees to complete this preliminary plan in the semi-structured format, as you can tell from the template itself. For us, it's hoping to provide enough consistency for the commission to evaluate the quality of the plan and to generate some meaningful learnings once our grant program concludes. And as you can tell from the very beginning, at the very top of the template, we've stated several things. I'm just going to quickly repeat it. We understand each grantee began at different times and may be at varying stages of planning as they conclude the first grant year. The template is intended to provide a general framework for what we wanted or what we expected for the final universal screening plan by the end of grant year 3. And our hope is for you to complete the template with as much information as you have available based on the stage you have reached. We broke it down into 3 stages, but we are welcoming any feedbacks and comments about how we decided the stages. Following that, I just want to quickly note that we are still very, very much welcoming any comments or feedbacks on the preliminary plan template. So please feel free to share specific recommendations as you and your team work on the plan and begin implementing the screening pilot study. Based on your feedback, we may adjust the final screening template to better document progress and summarize key learnings from the grant implementation phase. Finally, thanks to Lyra, we are aware that we're not ready to share the specifics of the review process yet, how we reviewed the preliminary plan. But we will make sure to inform everyone as soon as we learn we have more information on that. So hopefully this gives you a little bit of background. And if you have any questions, please let me know.
Great. Thank you. Are there any burning questions in this moment that would benefit the whole group that Buyang might be able to respond to? And private messaging, private chat is also good. You can also send us the questions you have and we can field them, all that. I think the takeaway that for us in shared languages that it's a working document. So based on your own local expertise, if you have feedback that CBH is definitely open to it, and that the review process is under construction, and that CBH will share with us shortly what the review process is like and will feel like for us. Okay, so with that, what we're going to invite you to do is move into your screening success partners, your breakout groups. In a bit, Stephen will open the breakout rooms, and room 1 will be Siskiyou, Lassen, and Stanislaus. Room 2, San Diego, Placer, El Dorado, and room 3, Santa Clara, Santa Cruz, and Yolo, even though Santa Cruz isn't here today. And we're going to invite you, I'm going to share in the chat, we're going to invite you to say hi to each other, take a breath, remind each other we're human, have some quiet time to review the screening plan template. And then we've got some questions that we are going to recommend to surface. Clarifying questions, implementation questions, what feels possible and energizing, what feels comfortable and fluent, like, yep, we got this, or what feels like a lift and a stretch. And I'm going to invite you to have one person to take some notes so that that person can post in the hub so that we can glean out where we are. And you do not need to call anyone out. You can just say, high level, this is what we shared and this is what we're working through. Okay, so we'll come back at 11:10. I know that in room 1, some really good clarifying questions came up. I'm curious about room 2, 3. I want to invite you right now to either put them in chat, or if you're open to it, I'm going to try and see if I can do this. We actually put a link in the hub for you to post notes or questions that came up in your chat room so that we can start to coalesce how the template is being digested. So I'm going to pause. Are there any, especially with Buyang in the room and all of us together, any clarifying questions for how to use this template or understand this template moving ahead? Go for it, Pilar.
I'm like, can I just unmute myself? Okay. So I have a whole bunch of questions, but I'm going to synthesize, I'm going to keep it simple. So I think part of my question was when I was going through the action plan, the very first question I had was like, oh, am I supposed to do this for each school that I'm working with? Because that's very, like I'm thinking of working with 2 schools, 2 very different grade levels, 2 different districts. What does that then mean? One school I might be able to more easily access a lot of the questions that are being asked, and then others might be a little bit more challenging. One of the schools is a community school. That's why I say that. And so I know we've done asset mapping and all that other stuff already with them. So that was my first question. And then it seems like it's probably a collective of how we're approaching the work and then what we're gathering from the schools that we're working with. So maybe some clarity around that. And then I just had some questions about what some of the actual prompts mean.
Mm-hmm.
For example, I will go into it and I will, for example, like just looking at the teaming, 1.3 is the way I'm looking at it in my head. So like the third prompt is differentiate the planning team from the composition and function of district and school site level pilot implementation teams as appropriate based on project context. And I'm like, I don't know what that means in the context of this, right? So an idea I was thinking of is if there's some maybe look fors or something that could help us, like it could be another resource, or it could be like copy of this. And then in those boxes, just being able to say, look fors could be X, Y, X, Y, and Z. If this is a design team versus implementation team, if that's what that means, then so be it. And then, so I think it was more good prompts. I want to know a little bit more what it means, and then what would be some look fors in that, if it's applicable.
Can you point to me what the question is again?
I was looking at the team, just in the screening action plan teaming. I was looking at the third prompt in the teaming. So in my brain, I said 1.3. It's like the third prompt.
We're talking about the first local planning team.
Pilar, I think you might be talking about the action planning tool, which is an optional tool, the spreadsheet, versus the preliminary plan template. Is that correct? Are you looking at the spreadsheet?
Correct. I'm looking at the spreadsheet. Yeah, the screening spreadsheet. Yeah.
Got it. And that's next on our agenda, to explain that tool a little bit and possible use for that. But the questions for Boyang were around the preliminary plan template itself from CBH. Yep.
Okay. Sorry.
No worries.
I haven't taken that apart to its entirety. I will, in Boyang. I could totally reach out to you.
Certainly. Yes.
Pilar, you did have a really good question, though, as far as the preliminary plan template. So you were saying that you're working with a couple of different schools with this grant, and you said, like, is this something that has to be filled out for each school, or is it a collective?
Yes, that is a question.
I think we haven't thought about that part yet, but my first reaction would be we're aiming for a collective story, but I am open for you to share individualized experiences if that helps you document your progress and the changes in the planning process. I think that's all important data, not just for you, but also for us to collectively generate learnings.
We had another question come up in room 1 around if an asset map or a needs assessment has already been initiated or implemented at the county level, is there permission from CBH to utilize that's already been implemented for the purpose of this process? And the idea that we also surfaced was, if the asset mapping happened last year with maybe people that are not on the planning team, potentially that the connection loop is to bring in already existing work and then utilize your design team as a review team, like what from that asset map feels pertinent, feels resonant and timely, and what might be still missing data, so that we're not recreating something from scratch. And I'm curious, Boyang, how that resonates for CBH.
I think we welcome existing resources and materials that already created, and I think your thinking is on the right track to create, utilizing the current planning team as a review process, and utilize the current team as, studying and reviewing to see if there's anything that you can utilize from the already created documents.
Great. And we did have a comment in the breakout room that folks were really grateful to see a kind of a structure to this process that they can map onto. So. Okay.
And to piggyback that, I guess my question for you would be is there rigidity, and sorry if this has already been answered, but I just want to be very clear, to make sure we answer and address each of these questions and have them as part of our final preliminary report? Or is it, I read that they're guiding questions, but I just want to be clear, like, do we need to answer each one of these and have it be in there, or can we kind of pick and choose and go with what the vibe is with our team?
That's a great question. When we're designing it, we weren't really thinking about having everyone answer every single question on the template. But in terms of the review process, that's certainly something that we are thinking about. So I think it wouldn't make sense for us to require answering for every single question. There are questions that following the creation, the logics of the planning guide. So yeah, there's no expectation to be just direct, and I'll share as much information as possible when we're creating the evaluation guidelines. So right now, the purpose is for us to have some guiding questions for us for the grantees to document their progress and the planning process. And we understand there are very different scenarios that our grantees are dealing.
There's a deep welcome for clarifying questions and for how to use this template questions, and that Boyang and team are really wanting and eager for those to come up, and they benefit everyone. So please do not be shy and forward them to us. I'm going to invite Tina to do one last component before we share the action plan template, and then we'll close. So Tina.
We are going to move away from the mentee just for time. So folks, don't do the QR code. We're just going to go ahead and move into the chat. And I'm posing a question, which is illegible there. So let me just re-add this right now. But the question to you all, I want you to think about and simply answer by, just a moment here, by putting a number in the chat. But we would like to know, and it'll help inform future sessions too, but where are you in this process? Where are you in this process? And thinking about you as an individual, not necessarily as a county, but as an individual. Are you in the process of developing, or have you established that local planning team development? This, of course, follows the CBH template. Are you in preliminary plan stage 1, where you're doing that asset needs assessment, resource mapping findings, or maybe in that pre-pilot planning activity stage? Or maybe you're already pilot study planning. Some of you have shared that you have a school or two that are that's trying this out. Maybe you are setting that up so that you can look at data so that you can continue to make informed decisions too. So, and some of you are already doing universal screening. And so evaluation continuous improvement is something that you want, that you're finding yourself in, pivoting as needed. So any number, I like the 2 to 3s. If you're in between stages, good to know as well. And again, this will help inform us for future sessions. And I think reminds us that we're all in different places of this process. So continue to put those numbers in the chat, and I believe I will send it back to you.
We're going to punt it. Can you tell that I have no idea what football is? Punt it to Christina, and then we'll close our time together.
So what we created for you as TCTs for program implementation, we know that organization and clarity are essential whenever we're trying to implement something new. And we've thrown a lot of different resources and tools at you. If you're new to a universal screening adventure or new to BHSSA work in general, this can feel very overwhelming. And so we've created an action planning tool that can be modified for your context, but essentially the goal of this tool is to marry some of the essential resources that have been offered so far. So looking at the Universal Screening Plan template, which is organized into stages, and that in addition to the lovely process guide that was offered in a previous session that is pulled from all of our best practices around universal screening and our research and the essential implementation components, which are the focus areas. And essentially this action planning tool, which thank you for dropping that in the chat for us, it's going to help you organize thinking about the plan template itself, the process guide, and those essential focus areas for implementation, and then breaking that down into some tangible steps. So what are those action steps that would be essential for me to know that I have completed this portion? And the goal is for you to be able to house some of those things on one go-to spreadsheet all together, and then engage in action planning with your team. So if I'm hitting some troubled waters here, why is that? Let me go back to some of those essential activities and think about, did I really complete this step? And if not, let's action plan. Who is doing what and by when? and then being able to mark that off with completion and house some of your sources of evidence there. So then when it comes time to complete your preliminary plan template, you have many of your resources in place. So I'm just going to very quickly open up the tool for you in the last couple of minutes that we have, just so that you can take a peek and see if this might be something useful for you to try. So you can see up here on my screen, on the very far left-hand column, you'll see the stages. And these are the stages that the preliminary plan template that Buying was just speaking to and that CBH has created for our work is alluding to. So starting with teaming and bringing together your preliminary planning team. And then the next column is focused on those focus areas, which is aligned to the process guide that you've seen before, but also extends it beyond that to include some of the pilot stages and the implementation stages from universal screening. And then the third column is some of those activity items. And these are just a loose description of what would it look like to know that you have done that thing. And so some of the questions before were about, okay, what does that actually mean? Or what are the look fors? This is an optional tool. This is not a required. We're looking for a specific thing that you're showing to say that you've completed this activity, but rather a loose description to help you understand what would be a way to know that we've accomplished this specific task aligned to that focus area. And then thinking about our action steps. So align with that activity item. What is it that we need to do next as a team? And who do we need to engage in that process? Who's responsible for it? And when do we anticipate completion of that? You can then mark your status over here and link some handy resources. All of you are creating tools that are going to help you along your way. And those could also be tools that you share in our COP settings in the future and offer to others so that we can learn together. So as you scroll down here, you can see the focus areas, thinking about the big why. What are some considerations coming from the process guide? Our knowledge cultivation as we get into stage 1 and our pre-pilot planning, our asset and needs assessments, our resource mapping, all of the essential components that, again, if you are hitting some walls in your work, it's important to go back and think about, okay, did I complete these things? Could I be facing some struggles right now because we didn't take enough time to focus on some of these steps? Or maybe we skipped over them altogether. And then moving into our pre-pilot planning and really thinking about our implementation teaming. And I know a lot of the questions around the preliminary plan template, we're differentiating some of those who's. So we've started to gather our design team or our planning team. But then when it comes to the rubber, where the rubber meets the road of doing our implementation work, of actually implementing that screener on a school site, your implementation team might look a little bit different. And we need to go back to where we started with bringing that team together, organizing ourselves around our norms and our responsibilities as well, and thinking about engaging our community in this work. Then we start to think about things like screening tools and the logistical pieces like consent and assent and our screening process itself. So once we have chosen our screener, what are the steps to actually implement that screener on the school campus or within the district? And then moving into things like data management, our response protocol, and training. Who are the essential people that need to be trained around all components of our screening process? And then finally leading into evaluation and continuous improvement. So lots of different steps on here, but all that to say that all of these are important to be thinking about moving forward. And the hope for a tool such as this is to help us organize and make sure that we are moving through those steps thoughtfully, intentionally, and slowly so that we're creating the best plan for screening that we can. So we wanted to offer that tool to you, and I'll stop sharing here. And we're hitting the end of our time together, but we're going to roll into some time where we can dive deeper into this work if you want to hang on or receive some guided coaching in this work as well. Thank you for going back to the slides, Tina. But here to support you and wanted to offer this optional tool for you to use if it is helpful in your work to organize your BHSSA Universal Screening Plan.
Thanks, Christina.
Yeah.
And just so you know as well, if, for example, you don't have the links that you need, always go to the hub. I am constantly advertising it because what you need is on there, including this action plan. And I invite everybody, I hope that you all will stick around for this last half hour where you can dive a little bit deeper. As we wrap, I just want to share with you some reminders moving forward. One of the first things I want to highlight on this timeline is that in 2 days, on 1/15, you will also have time to be a part of drop-in office hours with the Placer County TCT. So Christina will be there as well. You can ask all your questions, come up with that list, or just be in the presence and see what comes up, or bring that action plan, whatever it is you need. Office hours are 1 hour, 10 to 11. And then our next session is going to be on February 20th, and it will be for the hour and a half material and then a half hour of coaching as well. So we'll always kind of have that structure for you. You see the rest coming up. As we come up with more ways in which to support you, you'll see those added points on the timeline, but you have that in your slide deck. These are the upcoming office hours. I just talked about the one in a couple of days, but wanted to make sure you have that there clearly. Also know the link is there, so you can join that way as well. Just again, drop in, join in any point in time for that office hour. Our hub link is here. I also put it in the chat so you can find us. And if you need more, if these times don't work out for you, we're always available for TA requests. So you have this as well. Know it's there. And just reach out, reach out. And aside from that, I want to thank everybody for being a part of today. Thank you for bringing your light and sharing your stories, addressing others' challenges, as well as sharing your wins and what the process has been like for all of you. And so with that, we'll go ahead and close the formal session. But again, stick around because we have a little less than a half hour, but some really in-depth time that you can spend with Christina. So thank you all for being a part of today.